Hi, everybody. It's Mary Rowe from the Canadian Urban Institute. We're really glad to have you back for another installment of City Talk. These are conversations that we're having with city builders across the country, trying to create the kind of connective tissue to allow us to make sense of what's going on. What have we been seeing that's working, what hasn't been, and what's next as we continue to cope with an extraordinary global event that has exposed all sorts of things that probably were underlying challenges or underlying conditions that existed before COVID, but now there's no getting away from things that were dysfunctional and weren't working. Now they have been exacerbated, and we're going to, we've been using a phrase here, there's just no more excuses. We as urbanists have to come to terms with the ways in which urban life was working for some people and not for others. And how are we going to come out of this and emerge through this in stronger ways? So we're always really, really pleased when people take time in their day to come and share with us their expertise and their perspective. As I suggested, these are national broadcasts. We have people who do listen in from other parts of the world. So I would encourage all the people that have signed on, if you wanted to sign on to the chat, and there's a whole active discussion that takes place in the chat. Sign on, tell us where you're listening from. That's always interesting for us to see. And just a cautionary comment that if you're participating in the chat, everything that you write in the chat stays in the chat and it will be posted afterwards. So keep that in mind. Similarly, this session gets videotaped, and that shows you how old I am that I see videotaped. But you know what I mean. It gets captured and digitized, and then it's put on the internet, and people watch it again and again and again. So we're really appreciative of people being willing to share their content and let it be shared more broadly, because lots of people don't watch during the day and they watch in the evening, or they come back and watch it again. These broadcasts, in our case, Toronto, we originated in Toronto, although, as I suggested, CUIs across the country with partners across the country. But Toronto was the traditional territory of the Mississaugas of the Credit, the Anishinaabeg, the Chippewa, and the Haudenosaunee, as well as the Wendat peoples. And it's now home to many diverse First Nations across Turtle Island. Toronto is also covered by the Williams Treaty, which was signed with the Mississaugas of the Credit, and Treaty 13. Sorry, Treaty 13 was with the Mississaugas of the Credit, and the Williams Treaty was actually signed by multiple First Nations and Anishinaabeg nations. And we have these conversations in the context of a greater and growing awareness of the extent to which urban life has been exclusionary, and that those exclusionary practices and policies have created the kind of stratification that we see by gender and by income, and we're going to talk today about by age and by vulnerability. And CUI published 2 weeks ago a report at COVID 100. Every 100 days we're doing a check-in with stakeholders across the country to determine what's happening in urban Canada. And those first 100 days, what a staggering picture it painted for us of vulnerable populations, particularly older people, and the extraordinary death numbers that we see coming out of long-term care facilities. So obviously, there's a lot broken here, folks, and we've got 5 experts to help us navigate this and figure out, as I suggested, what's been working, what obviously wasn't working, and what do you think the implications are going forward in terms of how do we make inclusive cities that take care of people, and regardless of their age and their special needs. So you can see we got folks from coast to coast here, and I'm going to ask them each to give us a little 90-second piece to tell us basically their perspective, and then we're going to have a broader conversation about how cities need to be changed, and how do we need to change our framing, and how we build and plan cities to be more effective at coping with people as they age. So why don't we start? I always try to go from west to east. I always appreciate the Westerners have to get up a little earlier. So Megan, you're having your coffee. Torontonians are having their lunch, and in the Maritimes, you're probably having lobster, because why wouldn't you? But let's start, if we could, with SFU, and let's hear from you, Megan, about what your perspective is. And I think it would be helpful if you started by telling people what you do, what your job is, and what your focus is, and then give us your early perspective. Okay.
Great.
Thanks for coming to City Talk.
Great, thanks for the invitation. My name is Meghan Winters. I'm an associate professor in the Faculty of Health Sciences at SFU. I lead the city's Health and Active Transportation Research Lab. So we study how community design affects how people get around and connect with each other. In the times post, as this COVID pandemic unfolds, I think that what we've seen in the realm that I work in is a newfound importance of outdoor public spaces. And this is really important for older adults. So I'm in BC. We've launched into this sort of phase 3 where people are coming out, they are out in their communities. And we're seeing older adult populations also coming out into those outdoor spaces. Some of them are really nervous. That's what we see on the streets. Some of them are really keen for social opportunities. They may have been in their houses by themselves, and now they're really interested in being out in the outdoor spaces. We've also seen that the community centers, places they may have relied on for connecting with people, may not be open, or the kinds of coffee shops and meeting people for coffee. So they are now gathering, figuring out how to meet up with their friends in public spaces, in parks, going for socially distanced walks, but they're nervous about being close to other people. So just a couple quick things that I think need to continue to be very important as we're going forward here. Things about streets allocations and making sure that we have enough space for people walking and cycling so that the walkers feel safe, the cyclists feel safe, and everybody has enough space to spread out. And then a real challenge that people of all ages have been impacted by, but especially older adults, is the lack of bathrooms. So as COVID has happened, we don't have as many public facilities open, and the number of times I've been looking for a bathroom or I've been asked if I know where there's a bathroom that's open is really limiting our ability to spend time in those public spaces for people of all ages. Thank you.
Thanks, Megan. I mean, it's interesting, I was having a conversation earlier this morning with one of the city managers in the country and talking about how municipal service workers, employees of cities had to be redeployed through COVID. And that one of the biggest preoccupations, so you had people coming from one of our colleagues, Lisa, who helped put this session together. Her husband is a planner for the City of Toronto. He got redeployed from the planning department over to do emergency services. And one of the priorities that municipal staff had to figure out was where are outdoor bathrooms? Yeah. And that was true for parks and all sorts of things. And it's, again, this pre-existed COVID, but now you're in a much more critical place where we realize we haven't figured that out. It's a picture of urbanism, piece of urbanism we've not figured out properly. Okay, let's go to Rob. Rob is saving us from being a WANL. We had a WANL last week. And since there have been decades and decades of MANLs, we think the odd WANL's okay. But Rob is saving us from being a WANL and being, is coming to us from Lethbridge. And Rob wears two things. He just told us on the call, he's also a city councillor. But I should just say that, as I mentioned, my colleague Lisa, she was putting this program together and very, very appreciative of the Public Health Agency of Canada's Pan-Canadian Age-Friendly Communities Reference Group. But that's a hell of an acronym, whatever that is. But that group, of which you were a member, I think, Rob, that's how we got to you. So appreciative that there are different forms of learning networks that we need, right?
Absolutely.
Figure all this out. So Rob, talk to us from Lethbridge, could you?
Hi, Marianne. Welcome to the rest of our panelists and all our participants today. So I'm really excited to be here. I don't consider myself an expert. I consider myself really fortunate that I'm engaged with a whole bunch of smart people around the country and in the province. So I get to learn from all of you and to learn from my colleagues all over. So I wouldn't say I'm an expert, but I'm a bit of a sponge for information. So let me get that clear. Second disclaimer is this is my COVID hair. It's not the same as my headshot that was in the poster. Haven't had my haircut since the end of February, so that's why this is really me. So just let you know that. I'm the executive director of Lethbridge Senior Citizens Organization, which is a pretty good sized multi-sector, multi-service seniors organization in Lethbridge. We do everything from social services to activities to Meals on Wheels. And we have a large 56,000 square foot facility where we do all this in. I'm also, as Mary said, I'm a city councillor in Lethbridge, so I have a unique perspective on what the municipality needs to do during these kind of trying times, as well as how our senior sector pulls together. So two things, because you're going to all talk about the issues, and I'm going to talk about this later. What I want to talk about later more also is the huge collaborative effort that I've been a part of in the city of Lethbridge and region and the province of Alberta, and how we've pulled together as service providers in government to build a better sector for serving people. So that's pretty exciting that I'd like to talk about, and I'll echo a lot of things that Megan said as well about about how seniors are feeling isolated, and I'll talk a bit later about some of the things that we've done to try to engage them. 90 seconds.
That's well done. Followed instructions. Okay, let's go to the other side. Let's go to Laura, who actually I think is temporarily decamped in Sandy Cove, Nova Scotia. But you've got your fan club because there's somebody else from Sandy Cove who's just checked in. Laura, talk to us about your perspective, because you've been active, and I appreciate how you're all coming from different angles on this, which is great. It's very important. Academic and people working for municipal governments and people working for agencies and people working in advocacy. So Laura, talk to us about you and what you've been observing.
So my name is Laura Tamblyn-Watts. I'm the CEO of CanAge, which is Canada's National Seniors Advocacy Organization. So we are a pan-Canadian organization, and we have been very busy in the time of CanAge in our growth period with regards to the COVID-19. I want to focus a little bit on where informal boundaries inhibit connection. And we talked a little bit about how we're thinking about these things in terms of an interstitial process. I want to talk about where those things break down and how the walls, particularly walls of long-term care, although I'd like to spend a little bit of time talking about, we call it different things, retirement homes or assisted living or supportive housing, depending on where you are across this country. I'd like to talk a little bit about that as well. And so where we think about people living and where they get service delivery, and how those things have given a completely different experience in the time of COVID-19. I've been pan-Canadian myself during this time. I spent the first few months in Whistler, BC. So I was part of the Bonnie Henry show when we were out in BC. Then I spent about a month in Toronto and had the experience of being there. And then I've decamped to Nova Scotia. And what's been interesting about that is there are similarities and differences that you really feel very concretely in depending where you are. But I just also wanted to echo my colleagues. There's a sense of both fear, a trepidation, but there's also a sense of otherness that I want to talk about today, particularly for older people who've been living in congregate care settings.
Mm-hmm. Thanks. Okay, Vanessa, what's your perspective? Is Vanessa frozen? Just as I call on her, she freezes, wouldn't you know? We'll let Vanessa come back. Brenda, I'm going to come to you.
Thanks very much. Hi, everyone.
Oh, wait. Are you back? Is that you, Vanessa?
Oh.
No, we're going to find out what happened to Vanessa. Brenda, I'm going to go to you, and then we'll come back to Vanessa. Gina will try to track down. Oh, wait a sec.
Yes,
Vanessa,
I should be back.
Vanessa, are you there? Okay, Brenda, you go, and then we'll find Vanessa. Go.
Yes.
A stop and start here. Wait, Vanessa's there. I feel like you really want Vanessa to go, Mary. How about we, what's the feeling I'm getting? How about Vanessa, are you able to, I know Vanessa said her connection was a bit up and down. It looks like she might have froze again.
Yeah, you go, Brenda, and then Gina will work on getting Vanessa's connection. Vanessa, you might want to sign out and come back in. Go ahead, Brenda.
Thanks. So Brenda Vrkljan, I'm a professor here at McMaster University. I'm an occupational therapist by background, so trained as a healthcare professional, and then a rehabilitation scientist. And I also am a volunteer in our community on a long-term care board or long-term care facility that also services our older adults in the community amongst other vulnerable populations. So as an occupational therapist, I will say when we use the term occupation, I heard you use it, Mary, in terms of the work of your colleague. But when I'm talking about occupation, I'm talking about all the things that occupy people's time. And so when we think about those things, a good example was having to go to the bathroom is one example. And I really appreciated Meghan thinking through kind of the task analysis a little bit of the things we do every day and how with changes, sometimes due to health, sometimes due to other circumstances, our ability to do the things that occupy our time can be impacted. So our profession is really focused on supporting people, encouraging people of all abilities, of all ages, as you can imagine. So a very diverse profession in terms of, working and obviously working with other team members as well, not just in health, but also urban planners to think about how do we design our communities for these person environment transactions that occur, right? Because that's really what we want to do. And I'm an executive member of the McMaster Institute for Research on Aging, which is MIRA, that lovely acronym. You may hear me just refer to it as lovingly as MIRA, but our focus is on optimal aging, and so and also reimagining. And I saw that in the lead-in as well to this panel. So thinking about how do we support people in the community, and there is an opportunity here to reimagine, right, how we function and optimize function in the community. We've had to do major pivots here at the university. I'm sure Meghan is the same with her group, that lovely word pivot that we're hearing so often, but we had a focus as well on mobility. We're about to launch a cohort study, which means like a very big study to track people in their community, older people, and to figure out those subtle changes in mobility. And I know last week you were talking about transportation as an example, but we know transportation is active transportation, to sort of Megan's point, all the way through to wheeled mobility as well in our disabled or people with disabilities, their ability to get around the community and access it in all kinds of different ways. So all of that to say, this notion of optimizing aging is an important one. And we know that our population, our aging population particular, is heterogeneous. I never know how to say this, but very different from each other. So when we say aging, we really have to think about the diversity. And again, that marginalized population. So to your point about, the Black, Indigenous, people of color, who may have already had some struggles in terms of the time before COVID, as we know. So we just need to think about that threshold, right, in terms of helping people maintain, enhance, and partnering with people to help develop, the best solutions. It's very complicated. People are adaptable. I think it's amazing. I want to thank all our healthcare workers who are on the line, the people servicing older people in the home and in the community. I think that's another really important aspect. Caregivers, so we think of them as formal and informal. And I know Laura probably has some thoughts about that as well, because we need to think about not just the person, the older person, but that network around that person, and the effect of that. So all that to say, Mary, I'm really looking forward to the conversation with these panelists. I think your group's done a great job of pulling people together with different but complementary backgrounds.
Thanks. Thank you. Thank you for saying that. And we're glad to, what's interesting is that there are so many informed people in Canada who can share their understanding and their perspective. I'm hoping that we will find Vanessa, that we will get her back on. In the meantime, I'm just watching the tech team here to see if they're going to try to get her back. And she was on briefly and dropped off. So the four of you can those.
Yes.
Here's the question I thought we would start with. And I want us to see if we can differentiate between...
I am here, Mary, but I've just turned my video off.
Okay, well then, do you want to speak without your video? Go for it. Vanessa?
Yes, I've just turned the video off to save on bandwidth a bit.
Okay,
Yeah.
Go. Give us your perspective.
So thanks, everyone, and sorry about the technical difficulty. Sure. I work in the Senior Services and Long-Term Care Division at the City of Toronto. Actually just joined shortly before COVID escalated in mid-March. So it's been quite a few months. Our division is a mix of direct service delivery. So we run long-term care homes and supportive housing sites, adult day programs, community programs for seniors. And then there's a broader coordination and facilitation role with the broader senior sector. So that's the role I'm in, and I work very closely with many agencies and organizations who are supporting vulnerable seniors on the ground every day, working very closely with them to learn from them, support them throughout this pandemic, and hear what the issues are that they're seeing every day. And obviously there's a lot, and as you said, Mary, many existed before COVID, and this has really exacerbated them, especially for more vulnerable seniors, those with low incomes, limited social network, isolated, health and mobility issues, and intersecting vulnerabilities, like Black seniors, Indigenous seniors, racialized, newly immigrated, experiencing homelessness, and there are so many vulnerabilities. It's hard to narrow down the list of issues we've been hearing and seeing every day, because sometimes even the small issues like accessing pet food can have very real quality of life impacts for seniors. But some of the major ones that we're repeatedly hearing, no matter who we speak to, are, I'd say, access. And by that, I mean access to information and clear understanding of what's available from federal, provincial, us at the city, the huge community sector. How do they get the help they need? Access to technology, with so much moving virtually and it just becoming such a need in COVID. And then from the very early days, access to food, medications, and essentials. And then another big one is the social isolation piece and the impacts on mental health and loneliness. And as another panelist was saying, the anxiety and fear, I think Meghan was talking about that, that's starting to come out, now that things may be relaxing and reopening, how to sort of safely reemerge. There's a lot of inequities in how COVID hit our city, what neighborhoods and what groups have been impacted. And then, as I mentioned, I think now a big issue emerging is how to stay safe with public health guidance changing a little bit, but how to get the PPE and the masks, hand sanitizer that you need to be out and about, how to safely get to testing centers, or how can we get more mobile testing, all those kind of things on what that's going to look like now.
Thanks, Vanessa. The tech folks are going to talk to you about your headset because we're getting a little buzzing kind of feedbacky thing and see if we can clean that up. So they'll be chatting back and forth with you to see if that buzz off. Thanks for your comments. Can we talk about congregate settings, guys, gals, guy and gal? Because that's obviously something that's in the news, is that there's been a disproportionate death incidence of transmission and then higher number of deaths in congregate settings. And I'm sure that that's going to lead to all sorts of people suggesting that we now need to completely dismantle that system. And that I have a personal bias in this, in that my mother went into a long-term care facility. She's long dead, but for the last 5 years of her life. And that was, I think she would have said it was the best 5 years of her life. So I know lots of people have a very negative stigma about this, and I'm curious what you folks see in terms of, I know there's a gazillion challenges associated with it, and personal support workers working part-time and spreading the virus and everything. But what do you think what is the trajectory that you're imagining in terms of people that have high needs for that kind of support? I'm seeing Laura nod. Do you want to take it first, Laura? And then we'll hear some other folks about this.
Absolutely. So first, it's important to say that 92% of all Canadians, no matter their, will never live in congregate care setting. 92%. And in some jurisdictions like Ontario, it's 95%. So we're talking about a very small cohort. Of that cohort right now across the country, and this is a bit of a number, it's a little bit different depending on where you are, but about 20% of the people who do live in the congregate care settings could go home if they had the adequate supports that they needed, right? So part of what we need to be thinking about is also, what are we trying to achieve and what did we design the system for? I want to take it back just a little bit because I am a lawyer by training and I do teach at U of T, so I'll put my academic hat on for just a very short period of time. When we designed the Canada Health Act in 1984, that's the piece that said, how are we going to do healthcare in Canada? There's more to it than that, but that's kind of the big point. That lets you go to a hospital, whether you're in Lethbridge or in Halifax, that lets you get treatment. Mm-hmm. We didn't include long-term care in 1984. And in my view, it's not that we meant not to do it. It's just that the average age of death was about 76.4 years in 1984. Wow. And we mostly got long-term care, as we think about it, kind of in hospital or extended hospital settings or in family settings. And so now we have another sort of 10 years-ish on top of that if we're looking how our longevity is spending. So we didn't design the system in a way that meant to address where we are now. And we've known that for some time. What do we need to do to fix it?
Yeah.
So we think there's about 5 major things. They're not easy, but they're all very doable. You just have to actually do them. And the other piece I just want to share it to you is we've known how to fix this for a really long time. We just haven't really fixed it. Yeah, because you're always looking for priorities and money. So there's staffing fixes. We talked about that. And I'm happy to go into what the staffing fixes are. There's infrastructure fixes. There is kind of the adequacy of care. And by that, what I mean is an interdisciplinary approach to integrated care, as opposed to downloading the professionalization of care to personal support workers. So we need to change how the interprovincial and interdisciplinary care is provided. So staffing, infrastructure, the mix of care. We need to change the model of care. And if you don't change any other thing, let's change that one, because everything else kind of flows out from it. So we're focusing on what we call an emotion-focused or transformative model of care. And that leads to making sure that we also get better infection control, because we actually have to talk about that. But you can't actually get proper infection control with wardrooms of 4 people separated by a curtain with shared bathing facilities of upwards of 20 to 25 people. Like, you just can't do it. So we know the pathway and we know how it can be done. The piece I'll just add to it before I kind of turn it over is, we often do this when it comes to division of powers. Again, I'm putting my lawyer hat on for just a second. So it's true that the provision of care services is provincial, and we have kind of public health, which is federal, and then we have transfers of money that go to support those things. But we have the ability, and have certainly done before, to have desegregated, they call them directed healthcare funds, go to the provinces for particular things. We've seen that with hip health and macular degeneration and glaucoma and HPV vaccines and so other things. So we know that there is a system if you want to transfer and not get it lost to general treasuries, which has happened before in other areas, home care being one of those. And we can look to the Australian model to have an arm's length national regulator and talk about national standards and licensing and regulation. So it's not that our system is so problematic from a policy point of view or a governmental point of view that we can't do a intergovernmental fix to this. We can. So really happy to talk about those things and to hear from our other panelists what your thoughts are.
Yeah, I mean, just so you know, this, whatever you just did, this could be a theme of every city talk I do.
Yeah.
Because every piece of urban life, and one of the challenges we have is that there are competing jurisdictions and the funding streams aren't direct. And it's very difficult for residents, people that live in cities, to know who to hold accountable when there is a screw up. And I think that, as you're suggesting, this is, to me, a risk coming out of this, is that you're telling me that we've known for 30 years that we should be doing this differently. People in the chat are volunteering that the projections of seniors is getting bigger and bigger and bigger. We're gonna have more and more people of advanced age who are gonna live on. So Meghan, what's your perspective as an academic researching these things about the future of congregate living, and what do we need to do to actually address this, rather than, I don't want us to do a city talk 20 years from now and you're going to say, we knew 20 years ago.
Well, what I heard Laura say is that most older adults are living in their homes, and our work with the active aging research team here in Vancouver with older adults across the country is that they want to stay in their homes or in their communities. And so it's about building communities that are a good place to grow old, that have the supports that Brenda talked about, that enable them access to technology or access to services and technology. So they want to stay in their homes, and we're going to need that as we see this growing older adult population. Many are healthy individuals. They're healthy and they've got years of health ahead of them. So it's about building communities that enable them to stay in their homes. Again, it comes down to common themes that we have heard before this, but are exacerbated during COVID. So things about designing, urban design, that's the benches, that's the bathrooms, places to stop, places to stay. The COVID thing that has been exacerbated in terms of creating safe spaces so they can be out in their communities. We've heard a lot in our research. So I want to make clear that people who are older, they walk, they cycle, the e-bikes are out there. It's hard to purchase a bike these days because the supply is down and because of the huge demands for them. So that's enabling physical activity, it's enabling healthy lifestyles, but we need places for them to move.
So Meghan, can I ask you a question about, when you're suggesting this notion of sharing streets?
Yeah.
So, now we've got patios on streets, and now we've got bike lanes on streets, and now we're going to have e-bikes on streets, and streets being the largest chunk of public space in any city is the street. Have you started to navigate that? If you're saying more and more people are going to be older, is there a conflict there with avid cyclists? How do you reconcile? Some of them are on the chat, so I'm going to hear from them, but tell me how you're reconciling that.
So a third of our public spaces are streets. That's a third of the land space that we could be using. I think that what we've all seen as driving declined rapidly was that cities could look different and could feel different. So do we have that extra space? The Federation of Canadian Municipalities has put out guidelines for street rebalancing, so to help municipalities move quickly. And I want to commend municipalities across the country that have managed to reallocate road space. So is there a conflict there? Well, if you're out on the streets watching right now in some of the areas of Vancouver, for sure, there are huge numbers of older adults out on bicycles right now. So I want to just emphasize, and in our work before this, that older adults do use their bikes, and the e-bike trend is off the hook. So that's something that really facilitates people using these across different age groups and to go further and make more trips. So we're seeing a surge in that kind of pricing. Is there a conflict, Mary? Well, it's all about making sure that there's adequate space for people. So certainly what we've heard through research for years and years now, is that, well, some do cycle. People who are walking on the sidewalk sometimes don't hear cyclists going by them. So it's really important that the cyclists aren't on the sidewalk. And to keep them off the sidewalk, you need space for them to feel comfortable and safe riding on the streets. So when we think about reallocating streets so that there's space for the cars, so that there's space for the bicyclists, so that there's space where people feel safe on the sidewalks as well with children, whether they're older adults, whether they're hard of hearing. And the e-bikes move fast, right? They move fast, quiet. So we need to make sure, and the cities are really actively taking charge of that. What I want to see is that these temporary changes that are happening in cities, what are we thinking about moving those into permanent solutions? So what can we learn about the pilots and fast reactions that city and municipal staff have had to reallocate that road space? Will it become permanent in certain communities, especially around places where maybe older adults are and need to be moving around? Is
anybody seeing already, are you getting your little wish list together of things that you want to have stick? Brenda, are you tracking that to say this is a good improvisation, we should formalize that? Anything like that on your radar?
I think the notion, one thing I've seen is people out walking more. I think so even this notion of walking neighborhoods, you read and hear lots more about the notion of, not necessarily going into the trails, although people do in beautiful Hamilton, that there are these lovely walking trails, but this notion of people walking neighborhoods and getting to know their neighbor during COVID, and so together with my parents, who also live in the same town as I do, it just so happens they moved here, I feel quite fortunate, but it's had implication in terms of caregiving, I think, around, so my social network, because they live here, and my social life looks much different because of my caregiving with my parents, and having that, I'll say, responsibility in the loveliest way possible. But I know it's a win-win situation. I happen to like my parents. That's not always the case with everybody, Mary, but we do get along to a point. And so this idea of us having our social circle quite tight, we're very, I'm very mindful of my parents. I mean, Meghan, I like the idea about people being on bikes. I know that's a West Coast philosophy. I do not, as a caregiver, like the idea of my dad going out on a bike on a trail. He has mobility and musculoskeletal issues, 2 knee replacements, those kinds of things. So his activity, Mary, is through Zoom. Him and my mom are doing an exercise class together in the basement. That's what I'll call it. So they're leveraging each other's performance. There's so many good things that have happened, honestly. And that's what I want to say about people's adaptability. But how do we leverage and hear those stories? I think there's lots of stigma and stereotypes about aging. Same with the tech side. I see lots of people mentioning tech as a potential solution. I think we have lots of seniors that are very tech savvy as well, and that can be leveraged. I've had meetings through Zoom with older adults. They know how to use a cell phone, Uber, those kinds of things. But we just, again, the notion of choice, the notion of, making sure they have the right information. That's one thing I'm very concerned about, is the quality of evidence. So McMaster actually created the McMaster Optimal Aging Portal. So if you just Google those words, and maybe somebody can write it in the chat, but McMaster Optimal Aging Portal. And they have pivoted again to include a COVID style theme, but it gives good evidence, right, around, doing exercises online, seeking seeking mental health, options, because that is a huge implications is, we lose our social ability, our social network, and the impact on mood.
So can we talk about that for a sec? Because I think that's partly what I'm reflecting in terms of my own mother.
Mm-hmm.
She had lived a very isolated life as a mobility challenged senior, with a dynamic in her own life with her husband that wasn't a very constructive one. And so when she basically went into a community. And so I'm interested about the stigma that may now continue to be reinforced.
And I think Mary, this notion of like, I had lots of people when I was working as an occupational therapist, I want to go home, and actually home was not the best place for them. They were, on their own and alone. And that does it. So when they are, with others, and I think the congregate setting of, can be a better place for people. I don't think some of the homes are set up necessarily in the right, obvious, to state the obvious, in the proper way. But so going home and being at home by yourself is not always optimal. But how do we develop and design, to Laura's point, these congregate settings? So interdependence, I think, is actually a better word. That's what we are as humans. We do rely on each other. We don't often just do everything on our own. And that's the way cities function too, right, is interdependence. And I'm sure Rob has some comments from his seniors groups about.
Hey, Rob.
Yes, thank you very much. So I'm going to run through this quickly because I can address a lot of things that you just said. So another part of my role is I'm on the board of directors of the Green Acres Foundation, which is a managed housing body that provides residences for seniors in 3 different communities with about 12 different facilities across southwestern Alberta. We're lucky we've had 1 case. So the point about long-term care and seniors facilities as being this festering pool of disease is not always correct.
That's true.
And it depends on the response. We've had a lucky response. We're only hitting our first wave in Lethbridge now. And so we've tripled the number of cases over the last 2 weeks, which still isn't lots, but the rate is alarming compared to what we've experienced.
Mm-hmm.
But the ones that we're seeing in seniors residences are from visitation outside of the center. One, we think it was a staff person that brought it into not one of the Green Acres facilities, but a different one. What happened in Calgary and Edmonton, well, especially Calgary, was because of the workers working between different centers.
Rob, have you done any tracking? Just seeing a question from Abby Slater in the chat. Have you done any tracking, or is anybody else, in terms of a difference in outcome between a privately owned LTC or a retirement facility and a publicly owned?
Well,
is
no,
anybody tracking that to see whether it's substantively different?
Right. So in Lethbridge, particularly, we've had there's a couple of private operators that had no outbreak. They've had, because it seemed like in the middle of March, everybody locked down quickly. And to much the chagrin of family members, it was like, no, essential visitors only. They had all their contagion protocols in place. And this was not just Green Acres Foundation. This was the large ones like Extended Care and the other facilities. So we were lucky that way. The other thing I just want to address too really quickly is, so I'm on a committee called the Community Design Committee and also the Age Friendly Committee of Lethbridge. We're looking at things like complete streets. So Megan's talking about bikes and making space for people. The complete streets concept is enough room for cyclists, pedestrians, and cars. You look at Main Street project in Ottawa, which is pretty cool because the bikes had the outside third of the sidewalk. The pedestrians had the inside 2/3 of the sidewalk. And then the bikes were the ones that rode closer to the traffic, the auto traffic, than the pedestrians. So that was all done in renovating the sidewalk system just in this one street as a project. So we can do it, and we can do those kinds of things effectively. The other thing about addressing people living, Brenda was talking about people going home to nothing or being at home isolated. We're working on a couple projects in Lethbridge right now where we're doing postcard drops, and people are doing neighborhood checks. And even on my own organization, we did 1,500 phone calls over about a month and a bit to make sure all our members were okay, to do wellness checks. We had our Meals on Wheels volunteers checking with all our recipients. We have a lawn care snow removal program that we're checking on people. So I think it's I think Brenda said, it's also about you mobilize a community and you get people engaged in what's going on. we as a community engaged about 50 different organizations and over 150 people to start connecting around services around COVID. And what that has created a really cool ecosystem for helping organizations. So the food banks were giving excess food to group homes and to our Meals on Wheels program to use. Right, so it all starts rolling together, and what it does is it improves your chances for success and your positive outcomes post-COVID. It creates a new way of working provincially real quickly. So we've developed a new system in Alberta, but we're looking for community-based services for seniors, modeled after a similar system in BC. We already have Core Alberta, which is a collaborative online research and education portal, which we've done webinars and we've done discussion groups online similar to this over different projects related directly to seniors. In fact, I know some of my colleagues, Sean from Age Friendly Calgary is here, as well as John, and Carol from Alberta Seniors is here on with us, as well as some of my colleagues from the Age Friendly Reference Group nationally, and we've also been exchanging ideas. So I think that's a really big part of it is how do we work better together in order to produce the best outcomes. It's not just one agency or the government or a government working on it. It's how do we all work better together to produce the best outcomes for seniors and the community.
Yeah, and for the community at large. You know, I said we're in the connective tissue business, but I also feel that CUI is in the urban empathy business. How can we get to a place where we appreciate our interdependency? Laura, you wanted to jump in, I think, on the notion of private and public. Just giving, it would be great if we could get that set to rest, because there's a perception out there. I want to know if it's true. And then Vanessa, I'm going to call back on you. We've not forgotten about you, Vanessa. You are invisible but not forgotten. So we're going to come to you next. Okay, Laura, go.
So the evidence is still coming in, but in the time of COVID-19, it is not necessarily indexed between public and private. There are other factors, including leadership, the age of the facility, and so on, which have been more impactful. It doesn't mean whether we should or shouldn't have that. It's important. And most people also have a hard time understanding the difference between long-term care, or depending personal care homes if you're in Manitoba, or whatever you want to call them, or the nursing home care, and what we kind of call assisted living or retirement homing, which tends to be private. And because they sometimes end up actually offering the same type of care, which is another question that we should have a discussion on, people are often confused between how it's regulated and what service provision it is. So the answer is no. There's slightly worse in some urban centers, particularly in Quebec and Ontario, in the private, but it's not statistically significant. The one thing I just want to jump in on, and this is a thing that's problematic when we're talking about seniors, we sometimes like to slip to how good things are and how wonderful they are and how great it is. I really got to tell you, that's not the experience of older people in congregate care settings in COVID-19. The narrative has shifted to outdoor cafes and golfing. I have to tell you, we are still in stage one. I have people dying every single day of terrible circumstances across this country. But we easily shift away from not wanting to look at those difficult scenarios and wanting to redirect to what I think it is important. We talked about active aging and healthy aging, and I was the first person to say overwhelmingly it's at home. But it's so easy to take your mind off the fact that we have cockroach infections, that we have people who spent 3 days without being fed. We have people sitting in their feces. We have people crying out for help for hours on end, and we let this happen in Canada. That we are 14th out of 14 of the OECD countries in worst possible outcomes, and that 18% of all infections were in long-term care and 81% of all Canadian deaths. So let's not kind of slip too far away from realizing that we've created this other barrier. And when we're looking at solutions, it's very easy to kind of say, this is an easier solution, and we can't see you in long-term care. We have these walls up, and somehow you're in some type of an institution, even though, of course, you're actually not.
Laura, right? I think when people are in that circumstance, right, they sometimes don't have a voice. The people that are working in there, we talked a little bit about the diversity of the workforce that's there, and juggling multiple, often also marginalized populations. So I think this notion of the caregivers exhausted, perhaps on both sides, the informal and formal caregiver. So this idea of being able to self-advocate for ourselves, and I know that we have some octogenarians on the line here today who are able to advocate for themselves and others. But I think that's the problem, that this population has been silent for so long behind the walls of long-term care, these larger congregate settings, that it's only been their mortality rates that has given them a voice, which is very, very sad.
Which is tragic. Vanessa, I want to come back to you and see if we can hear you at least. Just a point that I appreciate the criticism that someone has made, Jenny Heisler has made, that we don't have anybody on this panel with lived experience. And that is a mistake. That's a shortcoming from our point of view at CUI in terms of how we put these things together. And we always are struggling to make sure that we have a representation around the people that are actually engaged in the work too. And all of you are advocates or academics, not actually providing care. The other point that's been raised here is that lots of people that come into long-term care facilities may be coming in as visitors, but in fact they're caregivers. And that this is a blurring of roles. And so this is a complicated thing. I just want to say though, just saying, Jenny, when you said there's nobody on this panel over 60, I'm flattered. Thanks. I guess as moderator, I'm not considered a panelist, but I can assure you I'm over 60. Vanessa,
I'm just about there.
And Rob's almost there. So, but I don't want to minimize the point. The point is completely legitimate that there are people here who are speaking on behalf of, and we need to make sure that we're more cognizant of that and having more lived experience here. Vanessa, let's try your system. Can we hear you? Can we hear you? I don't think we can. This is regrettable. Vanessa, you can type your comments into the chat and then people will look at them. And sadly, we're not going to be able to have you, I think, participate directly. That's unfortunate, but it's the way it is. Let's go to the social isolation piece. Could we, folks? Because we've got people living in congregate settings, then we have people living with home care at home, and then we've got lots of people that may not present as needing anything, but in fact, perhaps do. We had an interesting experience on City Talk, our second most popular in terms of numbers, City Talk. We had hundreds of people come on to talk with librarians. And the head of one of the library systems, I think in Hamilton, said that his staff decided to call every card holder over 75 just to check in with them to see if they knew how to use the digital system to get a book online. And what they found was that the people were so appreciative of the call and they didn't really want to talk about the library, they wanted to talk about everything else. And so the librarians have continued to make those calls weekly to those people. So are there new ways that we can reinforce and support one another? Thoughts on that in terms of going, and I don't want to minimize what Laura's saying, because as you suggest, there are fundamental policy changes that have to change so that lives are not lost.
I think, to make sure that we're not sitting in our lovely academic silos as well and having discussions, all of our research projects at McMaster and the McMaster Institute for Research on Aging include older adult stakeholders. So I want to say that it is really important to us that we include the voice and that first person voice and that lived experience in terms of the way we design our projects. So they're equal members of the team. Not surprisingly, we have to think about how they're trained. So our patient engagement partners, for them to be able to understand, because sometimes, we get into nerdy talk. But nonetheless, I think the idea of people being able to understand people's lived experience. So we're doing a survey right now of 400 Hamiltonians, right, to understand the implications on their mobility and participation. And these aren't people that are institutionalized. They were meant to engage in our other project, right? So this idea of already finding out how people are doing, how they're managing in the home. And to Laura's point, it looks like the people that are responding to our survey, even though it's random in terms of recruitment, do seem to be on the healthier side. And that may be the way things are panning out. But I think it is really important to try to get to those marginalized voices. And how do we do that to make sure they're included as well in our research? And that's always an ongoing challenge.
I mean, go ahead, Rob. It's almost insurmountable, though, that the care structure of aging, whether you're in a congregate setting or not, falls to women. I think it's heavily gendered, right? And in terms of people providing care in congregate settings, they're women of color, right?
So
Rob.
getting at the truly isolated people, though, is more than just surveying and phones. So I'll give you a really quick example. So the Alberta Seniors in Housing and TELUS we're going to do a project to get phone lines to people that are isolated, so they could call or get called. Well, here's a catch-22: is how do you find those people? Well, you can't find them. Even with all of our outreach programs and all the stuff that my staff do and other social care agencies across the province, you can't find the people that no one can find because there's no way to get to them. And the only way that we think we can get to them is a project we're trying to start right now is a mailbox drop of postcards to every single door in Lethbridge.
What do you mean you can't get to them? You mean there's no
How do you know who they are?
pool
Don't have a
for
phone.
these people?
Yeah.
But how do you know if they don't have a phone and they're not connected to anybody?
Yeah.
How do you know who they are? These are the
You
people.
know, in Hamilton, there's people that aren't getting their old age security, which would be huge, right, Rob? And I bet that's something else. So, you know, the city of Hamilton, we've worked with them as well, and they have projects where they're at the same thing, people going out and knocking on the door of the address, because that's, you know, but even then, will they answer the door, right? So this is a major challenge. I like the postcard idea a lot, Rob.
So that's a big job that my social work staff do as well, is to connect people to financial resources. And then if you find that they haven't been getting those the right funding for a number of years, there's probably some mental illness there as well.
You know, if we were living in the southern U.S., people would be talking about faith institutions. But that isn't part of how.
So we are actually already talking about faith institutions. I'm working with the Archbishop of Canada in the Anglican Church and the Lutheran Church. We're working on interfaith initiatives across this country because we actually are seeing interfaith attendance by about 10x across more of the Jewish, Muslim, and Christian faiths in this country. So because they're not showing up, but they're attending virtually. So we've actually been working very, very strongly with faith communities. The other one that we started up was with Queen's University. It's a pilot program which we're going to be rolling out to other universities, I hope to scale, where you, instead of calling up and asking for money about alumni, they're using their database to identify older alumni who are of a certain age who have no one else that lists living with them. And we started friendly visitor calls. So this is a trusted envelope of people. They know it's coming from a place that they already know. They have a trust relationship. And they're meeting 3 to 5 times a week virtually. And they have a 20% uptake from calls. I mean, that's an extraordinary 3 to 5 times a week, 20% uptake. So we're seeing kind of where communities already exist and whether or not those are emotional communities, spiritual and faith communities, or other types of communities, as opposed to kind of the cold call knocking on the door piece. So we really think that there's an important way of building on those relationships, but faith communities are an integral part of this as well.
It's multimodal, right? We have to go to multiple angles, multiple ways. And again, that just speaks to heterogeneity of the aging population, of our population in general, right? So we have to be really creative.
Is there some way to sustain this after COVID? I mean, if we had all these relationships stitched together before, we'd be in a much healthier situation when a crisis like this occurs. So if the impact of COVID abates, do you think we can lay down some of this track? Megan, are you thinking about that?
Well, I think, one of the things prior, our work on social connectedness, let's say, was seen as a bit of a soft health outcome and like, oh, nice to have, but we're interested in more mortality or, whatever, cancer. Hard to sort of get money to do research, to fund programs. And what I've really noticed now is like the priority, there's little pools of money for organizations supporting social connectedness, social isolation, and really addressing that head on. So one thing I think that will shift, already has and will continue to, is to continue to identify that as a core health outcome, which, people working with older adults have been asking for that for decades already, that this affects health in so many different ways and prevalent ways. So I think that shift will happen. There'll be more, hopefully, funding for programs in a long-term sort of way and lessons learned as to how to help them, because it is people who are the most isolated. But I mean, and speaking of my own parents who are able to live independently, it's hitting people hard. Even people who well-connected and had networks before, are really struggling with social isolation through these. And our technological connections can help to some degree, but a hug, hey? Like, how different does that feel? Or a face-to-face chat, even farther away, how different does that feel? So trying to reach out to the broadest
Right.
swath of people possible.
I think too, like we're training, sorry, yes, Mary.
I'm just going to say we've only got we really
Yeah.
only have 4 minutes left. So each of you roundtable to 1 minute each. And Vanessa is valiantly typing into the chat. Thank you, Vanessa, for being flexible. 1 minute each, Brenda, for what you think.
I think we have to obviously address the needs of the aging population, but I think the next generation, so we have, this undergraduate group at McMaster, for example, and we're trying to reach out even just to first year undergraduates to start to, I'll say, train them to interact with others, to have conversations and matching them with healthy, so to speak, community dwelling seniors. And so when they graduate, boy, do we have better citizens. I teach a class at McMaster. Somebody said, actually, what you're teaching in this class is how to be a better citizen. So how do you, have a conversation, address stigma and stereotype, listen to people, listen to what they want. And I think that is such an important aspect, is to have, I guess, a more caring society. Call me Pollyanna, but I think that is really important. How do you just check in on a neighbor and be a caring person? I think it starts with our next generation of Canadians who are wonderful.
Rob, a minute from you, please.
Quick minute. Let's learn from this whole experience. Let's learn about how we work together to make things better for people. What's worked, what hasn't worked. Let's look at what's positive outcomes for some seniors. My mom's 86. She lives independently in a condo. She golfs. She visits her friends that are on the first floor. She'll sit outside their balcony and have wine with them over the balcony. She does doorway chats with people who are there standing in the hall, and she stands in her entry. So you look at positive things like that. You build on that, and you look at the collaborative efforts by community organizations to make life better for people and seniors, and you keep building on that, and then keep that up post-COVID, so that we have this preparedness the next time this happens, or the next wave, or the third wave. And we're already have this infrastructure in place, whether it's formal or informal, and we're all working together. So this is provincially, this is regionally, this is nationally.
Yeah, this thing again. Okay, Megan, a minute from you, please.
Just say that, we really need to step up now and take seriously the responsibility to build resilient communities. So take this as a disruption, and let's make sure that the call to action happens, so that maybe there's less of this, so that we can learn from the quick steps we took and the pilots that we took to sort of build more permanent solutions to people living in congregated care, for people aging in place in their communities as well.
Mm-hmm. And you, Laura, a minute from you.
I want us to think about how we want to slip into happiness and well-being, and sometimes forget that things are not so good behind doors. And that when we're creating public policy, the feel-good stuff is important, but actually policy needs to focus on those who are most marginalized and most vulnerable.
Right. Well, listen, I appreciate so many of the themes that you folks have, and Vanessa, your minute has to be on the chat, so we hope you'll put your last thought in the chat while I'm just wrapping up here. So many of these themes, I think, exist in other sessions on City Talk, and we're starting to get a sense of this voice. How do we ground public policy in actual experience? How do we look at the specifics of a place and what they're struggling with? How do we make sure, that you just suggested, that people that are disproportionately affected by this kind of a crisis, how do we then redirect resourcing and thinking and really smart interventions to address that particular crisis? The one size never fits all, right? So we're very appreciative of you folks coming on. We always say that City Talk is not the end of a conversation, it's the beginning of a conversation. So we hope you'll continue that, all of you, at #CityTalk. We'll post the recording here. We've also had many sessions like this where we feel like we just scratched the surface, and that we need to come back and have a more in-depth conversation. So we look forward to people suggesting to us what the next conversation should be, in terms of what we really understand the impact on seniors and older and aging population, and how that's changing right in front of our eyes, basically. We published a report at COVID 100. You can go look at it. It talks specifically about vulnerable populations. On Thursday, we have another City Talk where we're going to talk about the other end of the spectrum. We're going to talk about young people. And we're going to actually talk, in this case, we're going to talk with young people. So the criticism won't be leveled on us there that we didn't have the direct group affected. We do have young people on the session on Thursday. And then next week, we have a huge, huge focus on the right to home. You'll be seeing more of that coming in your inbox. We have film screenings, and we have several panels, and we have many people participating on that who have lived experience as homeless or precariously housed Canadians. And this is one of those challenges, like the one that you folks have been identifying with us here, one of those challenges that we feel like we've got to try to emerge from COVID with some solutions. So let's hope that we've sparked a bit of a conversation here about how do we emerge with some solutions, because we're all getting older and we want to make sure that we're not disproportionately disadvantaging vulnerable people as they get older. So could I just thank Brenda, Laura, Megan, and Rob, and the invisible Vanessa for coming on to City Talk today. And I wish you a good day, and thank you again for participating with us.
Thanks, Mary.
Thanks, everyone.